Hair loss. Hair loss often is a presenting sign of lupus. And it can happen in a couple of ways. It can happen where you can lose handfuls hair by the handfuls very, very quickly. Some people have elevated hair counts. I mean, they're losing more than they remember. Some people have patches of hair loss. And then there are some people who have patches of hair loss that can not come back. So there's different ways that lupus can present. This first entity, it's not really well recognized, and there's not really a whole lot of literature about this. But I've seen this enough times where I think it is a distinct entity. And that's called this diffuse non-scarring alopecia of systemic lupus. And so this is when a systemic lupus is active, and then patients will all of a sudden experience diffuse and sudden hair loss. And it can be quite dramatic and anxiety-provoking. And you're losing hundreds of hair by the day. And in the past, people would have classified this as something called telogen effluvium, which I'll get into, but like I said, I think this is its own little entity. There have been some studies where they've actually biopsied patients who were going through this acute sudden hair loss, and there are some more specific changes that are seen here that is not seen in someone who was just shedding from some other cause. And so the hair loss is diffuse, rapid, can be complete or partial. This type of hair loss can come back if and when your systemic lupus becomes more active again. But the good thing about this is that it is reversible, so it's not permanent hair loss, and when the disease is under better control, the hair is allowed to regrow fully. And so these are some pictures of patients who have gone through this severe diffuse hair loss, and like I said, it can be quite dramatic. Now there's another entity called telogen effluvium, which is a fancy word for shedding, and it has lots of different causes. This is a short list, but anyone with an acute or chronic underlying illness, if you've been sick for even just for a few days, if you've had surgery, especially under general anesthesia, postpartum shedding is as a result of childbirth, sudden or rapid weight loss, protein deficiency, thyroid disorders, low iron, vitamin D, medications. Those are all risk factors for increased shedding, increased hair cycling. And the two that I've highlighted are ones that can be seen in the setting of lupus. And so what happens when somebody starts to shed is the picture on the right is somebody is kind of a picture of a normal scalp where 90% of your hair follicles are in the growth phase. Sorry, the top line, not the first picture, and 10% are in the resting phase. And when somebody's going through a shedding cycle, that ratio gets shifted, so there's less hairs in the growth phase and more hairs in the resting or shedding phase. And so that means that your daily shedding can go from something like 70 or less hairs per day to something like over 200. So what happens is that your body is stressed when you're going through an illness, or if you're going through or on a suspect medication, have just given a childbirth or something, or even severe psychological stress can do this, where all of a sudden your hairs shift from growth to resting. And it can stay in that resting phase for a couple months, so the shedding is not seen at the time when you're going through this stressful process. It's oftentimes seen a couple months later. So that's why this differs from that first hair loss scenario where someone has lupus, it's active, and they're shedding diffusely. This one is usually a couple months later is when it would happen. There's a delay. and it lasts 3 to 4 months, provided that the insult or whatever is causing it has stopped. And usually, we do something called a hair pull test, and it's very positive. So you will get more than 6 to 8 every time we tug in different areas of the scalp. So these are some of the medications that can cause someone to shed, and the ones that I've highlighted are ones that are used in patients that were with lupus that we're treating. So high-dose systemic steroids or prednisone, and then there's that family of retinoids, which is isotretinoin or soriatane. But there are other medications also that can cause, especially the first 4, that can cause telogen effluvium or shedding. So the treatment of shedding is identifying the cause. And once that cause is fixed, then the shedding will resolve a couple months after that happens. If it's an underlying medical problem, such as an underlying autoimmune condition like lupus, then you want to treat the disorder, and once that's under better control, the shedding should slow down. If it's drug-related, you really want to be sure which drug, because a lot of times when you're diagnosed with lupus and it's very active, sometimes you're started on 3 medications at once, and it's sort of hard to sort out which one is the culprit drug. And so what I usually recommend, and I usually work with people's rheumatologists, and we try to eliminate one at a time or switch things around, and then seeing if the shedding stops. And sometimes we can't stop a medication. Sometimes it's just one that you have to be on, and it's just, you kind of have to accept that you're just going to cycle fast, and that's just the way it's going to be. There's this other entity, which is, again, not well recognized, but definitely I've seen a few cases of this, and this is patchy non-scarring alopecia of lupus. And it is similar to the diffuse variant, but it's, instead of losing hair loss diffusely, it comes out in small patches. And it closely resembles another autoimmune patchy hair loss condition called alopecia areata. And oftentimes it's misdiagnosed as that, but I do believe that it is its own entity, and it oftentimes presents at the same time that someone has systemic symptoms of lupus, and at the time that that's being diagnosed. And it also is reversible, and it also improves once systemic lupus is under better control. And so these are pictures of patchy non-scarring alopecia of lupus. And then the last hair loss disorder that I'm going to talk about is discoid lupus. So this is a form of scarring or permanent hair loss. So the first 3 disorders I talked about are not permanent, but this one can be. And this one can be patchy, oftentimes patchy. Sometimes it can just be a diffuse process. But typically patches of hair loss, the skin is usually red or pink. There's sometimes that atrophy, a little bit of a depression in the skin. The scalp is a lot of times symptomatic, so there's itching and pain, and then there can be some pigment changes that happen as the lesions heal. And so these are some pictures of discoid lupus in hair-bearing areas, mainly affecting the scalp. In the first picture, you can see how red and scaly the skin is. In the next picture, this is how the lesions heal. So oftentimes with a rim of hyperpigmentation, and these are in darker skin types, this can happen, and then lighter in the middle. This is an earlier stage one, and there isn't any scarring that's happening yet. So if you catch it early and treat it early, a lot of times you can salvage the hair follicles, and you can prevent that scarring from happening. And this is more of an end stage individual who's had quite a bit of scarring. So the treatment, as I mentioned, if it's diagnosed and treated early enough, you can actually salvage the hair follicles, prevent scarring, and regrowth can happen. If the disease process goes on long enough, the stem cells of the hair follicles get damaged, and the hair follicle is not able to regenerate even when the inflammation has subsided. So the scarring happens, and then there's no hope for regrowth in the existing patches. So the goal in those patients is to prevent further loss. We really want to keep a close eye on the patches, treat them, make sure they're not getting bigger. I use a lot of photography in my office, so we're photographing lesions, measuring them. Once the lesions are treated, they can burn out or become inactive. But like I said, no potential for regrowth. So what can be done? So for small patches that you're not getting regrowth, one of the simplest things you can do, kind of like Dermablend, is use hair loss masking product or makeup for your scalp. And they come in all different variations: powders, fibers, foundations. You can always change your hairstyle to cover up or mask areas of loss. Use hair extensions, hair accessories, or partial or full hair pieces, which Brenda Kay will talk about. Medically, what we do, oftentimes if they're isolated patches, we'll just use topical steroids, or we'll inject steroids around the periphery of the discoid lesions. Or if it's a chronic process, switch over to one of these non-steroidal medications, Protopic or Elidel. Orally, it's the similar list of medications I showed you before for treating systemic lupus. I most often will use Plaquenil, but if that's not working or someone's in a really big flare, we'll do prednisone for a little while and then try to switch them to Plaquenil. And then these medications are sometimes used if the first two are not working. Surgical interventions. I have a lot of patients asking me if transplant is ever a possibility, and I think it can be. Lesions that have been burned out for at least 1 to 2 years, there are some surgeons that are attempting to treat this with hair transplantation. So in hair transplantations, you take hair follicles from uninvolved areas of the scalp, and then you surgically remove them and transplant them into the scarred areas of the scalp. So that is one way. The other way of treating is something called scalp reduction, where you actually can cut out the scarred area of the scalp and bring together the healthy hair follicles around it. But there are risks involved, and sometimes the trauma of the surgery itself can reactivate lupus all over again on the scalp. So that's one potential downfall, and then surgery will never prevent new areas of involvement. And that's it.